Hello everyone and welcome to this first video in a series of videos where we will be navigating through clinical scenarios. We'll be taking a deep dive into the thought processes you need to develop when a patient presents to you in clinical practice. And this should equip you with the knowledge and understanding to tackle any clinical situation you are presented with. So without further ado, let's dive in. So we have a clinical scenario here. A 3-year-old boy is brought by his parents to his clinic. His parents have noticed that he seems to struggle with movement and coordination compared to his peers. He often seems stiff, particularly in his legs, and often stumbles and falls when attempting to walk. They also note that he preferentially uses one side of his body more than the other. There is no history of seizures, feeding, or swallowing difficulties, and no significant illnesses. Here is an overview of what we are going to talk about in the first section of this video. Let's jump into each aspect in more detail. So when you look at this patient, there are two key things that you need to consider. One is the symptoms and the other one is the age. So let's first dive into more detail with the symptoms first. So given the child's specific symptoms reported by the parents, so that includes a child's struggle with movement and coordination, stiffness, the frequent falling, and preferentially using one side of his body. This suggests a disruption in the nervous system's ability to control the muscle movements properly. Especially the stiffness in the legs can be indicative of increased muscle tone or spasticity. These are usually common features of neurological conditions such as cerebral palsy. Movement is controlled by the signals from the brain and muscles, so an abnormality in this case spasticity, that can indicate that there is an issue between these two signaling, and that can lead to involuntary muscle contractions, which this child is exhibiting. Another indication that there may be some abnormal signaling between the brain and muscles is the difficulty in maintaining balance and stumbling quite often. So that kind of indicates problems with proprioception and balance control, again, which are controlled by the nervous system. So we are told that the child uses one side of the body more, and this is called hemiplegia. And this is a type of cerebral palsy characterized by weakness or paralysis on one side. So now that we've kind of looked at the symptoms, let's look at the second major consideration in this clinical scenario, which is the age. Now, this is an important factor to consider because symptoms of cerebral palsy often become noticeable during the first few years of a child's life, typically by the age of 3. And this is the case because this is a really crucial development period, and if there are any delays or abnormalities in reaching motor milestones in this age range, that can be a really strong indicator of cerebral palsy. So these neurological symptoms kind of paired with the age, we are kind of leaning more towards a possible diagnosis of cerebral palsy. Cerebral palsy stems from a damage or malformations in the brain, which occurs during the development of the brain before birth. And linking back to the clinical scenario, we know that the patient is exhibiting increased muscle tone, abnormal movements, and delays in reaching motor milestones, and these are all manifestations of the impact on the nervous system from cerebral palsy. So there are various medications you can use to control these symptoms, such as baclofen and anticonvulsant medications and botulinum injections as well. And these are used to target the lack of muscle control or muscle spasticity towards the nervous system. So now that we've formed a diagnosis, there are 3 assessments that you can do on this patient: neurological, developmental, and imaging. So with a neurological exam, you would assess the child's strength, the muscle tone, reflexes, coordination, and balance. And the key thing that you're trying to look for, especially with our kind of working diagnosis, is asymmetry. Asymmetry, or kind of favoring one side, which we know in this child is the case. And if the outcome of this assessment indicates abnormal movements or reflexes and asymmetry, that would suggest a diagnosis of CP. The next assessment you would carry out is a developmental assessment, so assessing the child's developmental milestones, and again, any abnormalities on that would contribute to a suspicion of cerebral palsy. And in this case, the parents have already reported that there is indeed a delay in the child's motor skills. Now, the final assessment you can do is imaging. An MRI would show any brain damage or any malformations that have led to CP. Other investigations can be carried out depending on the findings to rule out other conditions. We would carry those out usually when there is a suspicion of a genetic or metabolic disorder. So let's say you have carried out these investigations in clinical practice and you have found abnormal findings, specifically with the increased muscle tone and abnormal movements. We have looked at these 3 assessments that you can do. However, it's important to remember that cerebral palsy is a clinical diagnosis, and not all children with CP will have identifiable abnormalities on imaging or other tests. Some differentials you might want to consider when this patient presents to you, as we have touched upon before, the genetic and metabolic disorders, but there's also muscular dystrophy, spinal cord injury and diseases, and certain infections of the brain. Now, it's really important to have an early diagnosis because this can allow for early intervention and treatment, which will ultimately improve the child's quality of life and help them reach their full potential. That brings us to the end of this video. We have gone through what you should be thinking when a patient of this caliber with these symptoms presents to you in clinical practice, what kind of investigations you would carry out, and finally, how you would manage these patients. Watch out for similar videos coming soon where we'll be talking through other clinical scenarios and the processes you would go through to kind of equip you with real case scenarios. Thank you.